you've done such a great job explaining the axis of illness, which I absolutely love. It is so important to understand that, yes, it will circle and cycle down negatively, but it can also cycle up positively. So I wonder,
and quickly.
Yeah,
that's the crazy thing. You don't have to wait for 10 years. You can find out in about 4 weeks if it's working for you or not.
Yeah, that's right. I wonder if we could go into a little bit more, like explaining why it is that consuming so many carbohydrates is really so bad for us. When we hear things like the brain needs carbohydrates, or it's a quick, accessible fuel source. It's good for, my kids at their soccer game or whatever. Maybe we can talk about that, and maybe we can contrast that with why is a ketogenic diet so good for us?
Yeah, so there's a lot in the question that you asked, but it's a great question. So there are a lot of myths out there, and they're just myths that, like many memes, they just continue because we don't really discuss them. But the notion that the brain, for example, needs 150 grams of carbohydrate every day, that's because the brain cannot metabolize fats and cannot metabolize proteins. So it has to metabolize carbohydrates. There's an extra little layer of protection called the blood-brain barrier, and you need special transporters to get things through there. Well, we've known since Cahill studies in the 1960s that the brain can actually use another fuel other than glucose. The notion was that, and even when I learned physiology, first year, it was like, oh yeah, the brain can only use glucose. So you have to make sure you get enough glucose in your diet. By the way, if I asked you just offhand, how much in terms of a volume, how much sugar, how much glucose is circulating in your blood right now?
Yeah, I know the answer to that, but I think that the real answer would shock a lot of people. Yeah. The answer would be about a teaspoon.
About a teaspoon, right? So crazy. Yeah, and of course it's replaced as it gets used up. It's not very much, so it's not like your blood is really sugary. Otherwise, it would taste sweet. So it turns out that your brain not only can use ketones. Now, when you produce ketones, you produce it through fat metabolism. So there's an easy explanation of how ketogenic diets help you lose fat is you're not burning carbohydrates because you are producing your own through something called gluconeogenesis, but the selected fuel, then you shift to burning fat for most of your non-basal metabolic purposes. And when you metabolize that fat, you produce ketones. And the only ketone is acetone, but it's all initially produced as acetoacetate, which is called a ketone body. Some of it gets converted to acetone, which is basically nail polish remover, and usually just breathe that out, which is how those sort of breath monitors for keto. I think there's Ketonics as a company that does that. And then the rest of it gets converted into something called beta hydroxybutyrate, or BHB. That's a really beneficial fuel. It's almost like a super fuel, and I don't use that term lightly. It's a super fuel in the sense that your body prefers to use that. So your brain, if there is an available supply of beta hydroxybutyrate, if you're keto adapted, which by the way is the normal human state, going back in our evolutionary past,
yes,
your brain will selectively use that. Now there is a transporter that it needs to get into the nerve cells, the neurons. It's called an Mct transport. It's not MCT oil, it's different MCT. But it goes down its concentration gradient. It doesn't have to be pumped in like glucose does. So it's actually easier for the ketone, the beta hydroxybutyrate, to get into the nerve cells and be burned there than it is for the glucose. And when it's burned or metabolized, it produces less inflammation, less inflammatory response. And of course, if you look at something like Alzheimer's, it's an inflammatory condition, as is MS and other things. So there's no surprise that that a ketogenic diet would have benefits for people with neurological problems. So one of the first uses in a clinical sense was over 100 years ago, or about 100 years ago, for epilepsy. And for some forms of refractory epilepsy, it's very, very, very beneficial. Check out the Charlie Foundation, for example, and their work promoting the use of ketogenic diets at over 200 hospitals throughout the world. I think that number is even a bit higher now.
Wow, amazing.
We've seen evidence that it's beneficial for Parkinson's disease. We've seen evidence that it's beneficial for mood disorders like bipolar disease. We've seen benefits for autism. And all of these are being studied, all these neurological conditions. So there's the brain now being provided with its preferred beneficial fuel that's less inflammatory. It's kind of like shifting from a gas-powered car in your brain to an electric car, suddenly you're not polluting that environment up there. And the other cool thing, Casey, is in our studies, when we image the women to view their tumors, the heart is the most metabolically diverse organ, that it'll burn anything. Anything. It's kind of like a diesel engine, because it just has to keep going no matter what. So you can throw sawdust in a diesel engine, it'll keep running. The heart will do that too, because it has to keep running. But when we see the women initially in our studies, and the imaging agent is a glucose, it's a radioactive glucose called fluorodeoxyglucose. So it has a little radioactive fluorine in there that allows us to image the glucose movement. And so we see it concentrated in the heart, because the heart will use that glucose if it's available. But when these women are keto adapted, the heart disappears from the imaging. So what's that telling you? Well, it's, the inference is kind of obvious, is the heart is preferring to use a ketone because it's less inflammatory. And what's cardiovascular disease? An inflammatory disease. So the heart's smart. It knows that this is a better fuel. I should be going electric instead of, burning fuel. And the brain does the same thing. The two most important organs, as far as keeping us alive and active, both prefer ketones. So that notion of 150 grams a day is just, it's nonsense. The brain needs as much fuel as it can, but it can get up to 80% of that from ketones, but that's only under severe starvation purposes. So where does it get the rest of the glucose if you're not in a starvation state? And that's through a natural process that all carnivores have, omnivores too, called gluconeogenesis, which literally means making new glucose. And that means you're making glucose for the blood, that teaspoon of glucose you need, that level of a teaspoon in 5 liters. Think of it, 5 liters of blood, and there's a teaspoon of sugar in there. It can produce that regularly by taking the glycerol from fatty acids, and mostly amino acids and other metabolites, and turning those into glucose as needed, ad libitum, as we say in medicine. And so you don't need to. That's why you don't need to consume any carbohydrates, because you really only need them for the glucose, and the glucose can be produced naturally, which is what your cat and your dog does, and most other carnivores. Totally natural process. Fiber, probably a story for another day, but it's there are beneficial fibers, but they're not metabolized into glucose. They're not broken down into glucose in the blood, so they shouldn't affect your blood sugar. In fact, some soluble fibers actually reduce your, the rate at which sugar crosses the digestive system. So you don't need it. There are no essential carbohydrates, right? And so the only reason we eat them, now you did mention a couple of performance states, and I can talk a little bit about that. That's more like Jeff Bullock's area. Parker Hyde, who's now at University of North Georgia, he's another guy to look at. He works with the US military there. By the way, there's a lot of keto people working with the military, because they're high performance, high risk jobs, right? So we want war fighters to have the maximum mental alertness, the ability to resist hunger, the ability to perform without injury. If you're divers, Dom D'Agostino in University of South Florida is studying Navy SEALs. And if you're burning ketones instead of glucose, your brain can tolerate much lower oxygen levels, so you can stand underwater longer. All kinds of super cool stuff. And obviously, we focus on that particular subject group because it's a very high risk, especially those specialists like Navy SEALs, Rangers, fighter pilots, that sort of thing, and greater mental acuity. I don't know. That's pretty important when you're doing those sorts of operations, right? Ability to withstand periods without sleep. All those sorts of things are all benefiting. You have to be careful. Like, there's so many myths out there. I mean, there's been a couple of great sort of blogs written about all the myths about diets and ketogenic diets. And one of the main ones is that there are essential carbohydrates because your brain needs 150 grams of glucose every day. So you have to eat it. That's a myth. The other one is that ketogenic diets are dangerous. They're not. Every physician learns about a state called ketoacidosis, which is often a complication of severe diabetes, where it's an artifact of the metabolism that occurs when your body can't metabolize sugar at all in diabetes, and because you can't get it into the cells to metabolize, so you start metabolizing fats like crazy, and your ketone levels go so high that your blood becomes acidic, and that's life-threatening. That does not happen on a ketogenic diet, full stop. I don't know why people worry about that. Your body will naturally regulate that at a much lower level, like a half to a tenth of that sort of danger zone. And you can look at any blood-borne factor in your body, and if it gets too high, it's going to create problems. If it gets too low, it's going to create problems. So ketones are just another one of those. But within that range, which we call nutritional ketosis, and I think that was coined by Dr. Stephen Phinney, it's usually about 0.5 to 2 millimoles per microliter. That range of ketones, it almost trades off against the sugar. So if that's like 1 or 2, then the blood sugar can be like 3 or 4, which might be hypoglycemic to some people, but to those of us that are keto adapted, it's just fine because the brain and the heart are burning ketones instead of sugars.